Kamusta ka na dyan? Huwag kang mabigla, ha? Iba gani sa ibang bansa. Kaya mo yan.
Now, Milo has more Protomalt for the energy to take your child further.
Next year, ikaw naman, Noy, ha?
Welcome to Oh My Diagnosis. Our featured topic for today is ichthyosis. So what is ichthyosis? Ichthyosis is the term for severe, persistent problems with the skin. Almost always starts during childhood or infancy. Ichthyosis can be genetic or can be developed later in life. In the large majority of people with the disease, the cause is related to one or more genetic mutations.
The body's largest organ, the skin, serves as a protective coat, guarding internal structures from the outside environment. It is composed of two distinct layers of tissue, the epidermis and the dermis. The epidermis consists of an outer sheet of dead cells called the stratum corneum, and a deeper section of rapidly dividing cells called the basal layer. When dead cells of the stratum corneum are damaged or scraped off during body activity, cells from the basal layer rise to replace them. The epidermis serves as the body's initial barrier to invading foreign substances. Directly below the basal layer is the thicker dermis layer, made of dense connective tissue. Embedded within the dermis are several kinds of important sensory receptors, including thermoreceptors, which detect temperature change, Meissner's corpuscles, which are sensitive to touch, and free nerve endings, which detect pain and tissue damage. The dermis also contains many other structures, including sweat glands, hair follicles, and blood vessels.
In normal circumstances, the body continuously renews its surface, building new skin cells and allowing older cells to be shed from the surface. Ichthyosis disrupts this balance either because too many replacement skin cells are produced or because the skin cells do not separate well from the skin surface when it's their time to drop off. The result is that skin cells accumulate into thick flakes that adhere to the body and can resemble fish scales.
Ichthyosis often causes severe cosmetic concerns for the person with the condition. However, it is not a contagious disease. The condition also can interfere with the skin's critical roles in protecting against infection, preventing dehydration, and regulating body temperature.
Most people with ichthyosis have ichthyosis vulgaris, the mildest form of the disease. It occurs in 1 out of every 250 people.
Let's know more about the signs and symptoms of the disease by consulting our friend, Kim.
Depending on the type of gene abnormality that causes ichthyosis, the skin can show different patterns of leaking. Symptoms of ichthyosis are either noticeable at birth or during childhood. Symptoms may include
severe dryness of the skin with thickening and flaking, which may appear only in limited areas or may involve almost the entire skin surface. Mild itching of the skin, body odor, because of the spaces under and between skin flakes can harbor collections of bacteria of fungus. Wax buildup in the ears, causing hearing difficulties.
Thank you, Kim. The signs and symptoms are quite alarming. What do you think, Veena? Yes, I agree, Jenille. It is most especially dangerous to children below 5 years. With the known signs and symptoms, how can we diagnose the disease?
For the diagnosis, a doctor usually can diagnose ichthyosis by looking at the skin. A family history is also very useful in some cases. A skin biopsy will be done to help to confirm the diagnosis. In a biopsy, a small piece of skin is removed and examined under a microscope. In some cases, genetic testing may be helpful in making diagnosis. For the expected duration, most cases of ichthyosis have a genetic basis and will last a lifetime. Sometimes, adult-onset ichthyosis occurs in association with a disease, and if the disease can be treated, the ichthyosis may go away. In most people, symptoms can be controlled.
There is no way to prevent ichthyosis. As with other genetic diseases, there is a risk that the children of unaffected parents will inherit the gene. Treatment of all ichthyosis involves restoring the skin moisture and facilitating more aggressive shedding of the dead skin cells. Regular visit to the dermatologist can help when the ichthyosis causes severe symptoms.
To get a better result, use moisture-retaining creams or ointments after a bath or shower, so that moisture is maintained within the skin surface. Petrolatum, lanolin, or urea-containing preparations are very helpful in maintaining skin moisture. But lotions or creams that contain lactic acid or other alpha-hydroxy acids are not recommended. If the ichthyosis leads to scratching that causes skin infection, or if body odor is a major problem, antibiotics may be needed from time to time.
Thank you for watching Oh My Diagnosis. Once again, I am Jenille, and I am Veena, and here we are again in Oh My Diagnosis. With the known signs and symptoms, how can we prevent BURGUILLOS?
In a biopsy, a small piece
There is no way to prevent ichthyosis. As with other genetic diseases, there is a risk that the children of an infected parent will inherit the gene. Treatment of all ichthyosis, restoring
That's more about
Depending on the type of gene abnormality that causes the ichthyosis, the skin can show different patterns of leaking. Symptoms of ichthyosis are ang taas.
I wanna scream and shout and let it